Welcome to part 3 of the 3-part series covering the most frequently asked questions when scheduling OASIS visits. Let's dive in. Is an actual assessment needed for an OASIS transfer? An OASIS transfer requires data collection and not actual patient assessment. Any qualified clinician may collect the data as directed by agency policy. It is not required that the clinician completing the data collection must have previously visited the patient. The information can be obtained over the phone by any qualified clinician familiar with OASIS data collection practices. Patient was readmitted to the hospital and discharged home, but agency was unaware and discovered during a visit by a home health aide, physical therapy assistant, or occupational therapy assistant. When the agency does not have knowledge that a patient has experienced a qualifying inpatient transfer and discharge home, and they become aware of this during a visit by an unqualified staff, then the agency must complete an OASIS transfer and then send a qualified clinician to conduct a resumption of care assessment. Both assessments should be completed within 2 calendar days of the agency's knowledge of the inpatient admission. Patient family decides that patient will be receiving hospice care at home. If a Medicare patient decides they are going to receive hospice in their home, complete the OASIS Discharge Comprehensive Assessment and select patient transferred to a non-institutional hospice. Patient dies while being transported to the hospital or in the hospital's emergent care room. A patient who dies on the way to the hospital is still considered to be under the care of the agency, and the death would be considered a death at home. However, a patient who is admitted to an inpatient facility or the hospital's emergent care center, regardless of how long he or she has been in the facility, is considered to have died while under the care of the facility. In this situation, the agency required discharge documents, e.g., a discharge summary, and an OASIS transfer discharge assessment, transfer to inpatient facility patient discharged, would be needed to close out the OASIS episode. Patient sent back to the ER before resumption of care completion and passes away at the ER. The last OASIS transfer assessment completed meets the requirements for the comprehensive assessment. No further OASIS data collection is required. The patient did not resume care with the home health agency. The agency's discharge summary should be completed to close out the clinical record. Transfer OASIS submitted. What is the next step? After an OASIS transfer submission, the next expected OASIS submission is the resumption of care. If patient does not resume services at your agency, then an internal agency discharge summary with no OASIS collection would be completed. We completed an OASIS transfer, no discharge. Patient did not return to agency. Do we cancel the OASIS transfer and resubmit an OASIS transfer with discharge? The quality episode ended with the OASIS transfer that was completed. You do not need to cancel the OASIS transfer and resubmit an OASIS transfer discharge. Complete your agency's internal discharge summary. Patient is held for more than 24 hours in an observation bed in the ER, but not admitted as an inpatient. An OASIS transfer is not required as the patient did not meet the criteria for the OASIS transfer. The home health agency will continue services as previously ordered unless there is a significant change in health status, of which the agency would obtain the necessary orders and perform an OASIS follow-up assessment. When is an OASIS resumption of care needed? An OASIS resumption of care is needed if a hospital stay was 24 hours or longer and occurred for reasons other than diagnostic testing. If the hospitalization was less than 24 hours, or was more than 24 hours but for diagnostic purposes only, no special action is required. You have 2 days from the point you have knowledge of a patient's return home from an inpatient stay, or on the physician-ordered resumption of care date to complete the resumption of care visit. Patient back home from hospital, both skilled nursing and physical therapy ordered. Can physical therapy do resumption of care assessment first? The requirement for the RN to complete an initial assessment visit prior to therapy visits in multidisciplinary cases is limited to the start-off care time point only. At subsequent time points, including the resumption of care, either discipline, a registered nurse, or physical therapist could complete the resumption of care assessment. There is no specific restriction preventing the physical therapist from resuming services prior to the RN's completion of the resumption of care assessment. If patient returns home within the last 5 days of the episode, do I do a recertification or resumption of care assessment? The resumption of care is always the first visit after return from the hospital for a patient who was already receiving services. If the return date falls within the last 5 days, complete a resumption of care assessment, not recertification OASIS assessment. The resumption of care assessment will cover for both the resumption visit and the recertification visit. The resumption of care visit has been completed. Patient, however, refuses further visits. If the patient returned home from the hospital and you made one visit, the resumption of care visit, and then the patient refused further visits, you are not required to collect and submit the resumption of care OASIS data to the OASIS system. OASIS is not required when only one visit is made at the resumption of care. Patient returns home from inpatient stay on day 60 or 61. When the patient returns home from the inpatient facility on day 60 or 61, you will need to complete the resumption of care assessment and then make a decision based on the HIPS code. If the HIPS code did not change from the Recert assessment, then you submit the resumption of care, as it is considered a continuous episode. If the HIPS code changed from the Recert assessment, care would not be considered continuous, and you would perform a discharge and then submit the assessment as a start of care. Patient hospitalized on the first day of the new episode following recertification. A patient may get hospitalized in the first days of an episode prior to receiving home health follow-up visits in the new episode. These cases are handled identical to cases in which the beneficiary was discharged on days 60 or 61. Patient admitted to hospital on day 58 and returns on day 59 or 60 or after the end of episode. If a patient is transferred to the hospital on day 58 before the recertification assessment was completed and the stay in the inpatient facility met the criteria for a transfer, the agency would complete an OASIS transfer. When the patient returns home, if it is on day 59 or 60 and they have not been discharged from the home health agency, a resumption of care assessment would be completed and would satisfy both the resumption of care and the recertification requirements. If the patient's stay extended beyond the end of the current certification period, the agency would perform an internal paper discharge from the previous episode, no OASIS DC required, and a start of care would be performed. Patient hospitalized after OASIS Recert assessment completed within the last 5 days of the CERT period. If the agency did not anticipate the patient would return to their care in time and performed an OASIS transfer with discharge, a new start of care should be completed when the patient returns home. If the agency anticipated patient's return and completed an OASIS transfer, no discharge. A resumption of care assessment should be completed if no changes in HIPS code from Recert assessment. If the resulting HIPS code is not the same as the recertification assessment performed in the last 5 days, then the 2 episodes would not be considered continuous. In this case, the patient should be discharged through completion of agency discharge paperwork or process, and the new assessment should be reported as a start of care, establishing a new certification period. What happens when both the RN and physical therapist are scheduled to conduct discharge visits on the same day? When both the RN and physical therapist are scheduled to conduct discharge visits on the same day, the last qualified clinician to see the patient is responsible for conducting the discharge comprehensive assessment. Is an actual OASIS assessment needed for OASIS death at home? An OASIS death at home requires data collection and not actual patient assessment findings. Any qualified clinician may collect data as directed by agency policy. It is not required that the clinician completing the data collection must have previously visited the patient. The information can be obtained over the phone by any qualified clinician familiar with OASIS data collection practices. What happens if the admitting nurse quits before submitting an OASIS? If the comprehensive assessment for a patient requiring OASIS data collection was not completed or submitted due to assessing clinician is no longer available or quit, the agency may send another qualified clinician out during the allowed assessment timeframe within 5 days of start of care date to start and complete an entirely new comprehensive OASIS assessment. Patient no longer receiving skilled care but continues to receive unskilled care. Home health agencies are recommended to complete an OASIS discharge assessment when a patient receiving skilled care no longer requires skilled care but continues to receive unskilled care. When the patient is no longer subject to OASIS data collection, complete an OASIS discharge and select patient remained in the community with formal assistive services. Thank Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. For helpful downloadable digital resources on home health management, check out the links below. For questions and insights, drop a comment. And if you know someone who could benefit from this video, feel free to share. See you in the next one.